JP, we're both engaged in this social enterprise, which we call the Evolve Pain Care Academy. And that enterprise is about bringing equitable access to understanding and, training, upskilling clinicians around managing pain. What's your motivator?
Well, I come from Brazil, and Brazil, it's a bit of a strange country because you have low, middle, and high income class in the same country. But access to education can be quite different in Brazil. So I feel like I'm privileged to have been able at the time to be able to go to university, to be able to work, to be able to get out of the country and go after the education that I wanted. But many people around the world, they may have the same desire, but they can't do this. We know that education is really expensive. We know that to have access to journal papers, it can be really expensive, or you might have to be linked to university. So there are lots of barriers for people to have access. These days with social media, you have snippets of information, but for you to delve in and have access to not only knowledge, but skills and mentoring is something that can be extremely expensive. And this social enterprise kind of taps into that triad that I mentioned before, where we're clinicians, we are educators, and we do research. How can we convey this experience and support other clinicians on their journey with the overall goal of reducing the burden of pain around the world? So the biggest motivation here is to actually create a pathway which is equitable. So people from different levels of capacity and income may have access to this. Is to create a scenario where people that have more can pay for those that have less. It's doing something that is way bigger than us. It's way bigger than the day-to-day clinical encounters, that has an honest and a genuine desire to improve the lives of people living with pain as we support the clinicians that are coming through to be able to deliver better care. And we are not doing that just of our beliefs and desires. There's a lot of work that has been done, a lot of research, and we'll continue to test that along the way. But that's the reason why we're sitting here, and we hope that this social enterprise can touch many around the world, particularly with our free resources for both to strengthen practice of clinicians, but also to support those living with pain and those around them.